Started. Welcome to the meeting and welcome to Friday, TGIF. I don't know about the rest of you, but glad it's Friday. Thank you for the food, County. It's great to come to a meeting that provides food. It's always so good. I think it looks like we have a really great agenda ahead of us. We're gonna have a roll call in a minute. Everybody doing okay today? Deep breath. So I think we're ready to get started. Thank you.
All right. Martin Moore, he's having technological challenges. I think he's traveling, so it's we sent him the link, but it's not connecting. So that's a challenge. That's why he's not with us now. Sybil Tate here. Myself, I'm here. Oscar Wooten, Sylvia Clement, Charlissa McDaniels, Alan Thornburg.
I'm his stand-in.
Judge Grant. Todd Williams. Sam Sneed.
Here.
Mike Lamb.
Jonathan Brown here from Mike Lamb.
Donald Ray, is it Ruth?
Yes, here.
Julia Horrocks. Deborah Campbell. Maggie Ullman. Michael Greer. And I think Michael Greer and who was other folks had,
Daniel Conway.
they had some, yeah, they had Dustin Dow. Jean Marie Christie.
Here.
Judge Kreppel.
She's here.
David Sweat.
Here.
And that's all. And what, I don't know what we need for a quorum.
11.
We don't have a quorum.
Just Judge Scott count.
So we can proceed with the agenda. The only thing that we won't be able to do is the other thing is, according to the bylaws, we have a vacancy, vice president. Is vice president, that's what they call it? Vice chair,
I'm
Vice
sorry.
the vice chair position is vacant. And apparently, according to the bylaws, you all created a secret email ballot. Is that what? Don't make sense to me, bud.
I remember a secret handshake, I don't remember.
So apparently there's a, in order to fill that seat, there has to be a secret email ballot.
If I may, the JRAC would nominate folks to be voted upon. So if there were nominations, then there would be a quote secret ballot as stated in the bylaw.
Do that in public service.
So they would nominate at the August meeting and then a vote would occur between the August meeting and the next meeting, is that correct? Okay.
Do we, well, I guess we don't have a quorum to really take any nominations. But we certainly do that. So we'll just throw that down to our August agenda. I'm not gonna go over that. That's just not computing in my head. Y'all have to forgive me when things don't make sense. All right. Okay, so
So next is the consent agenda. We don't have a quorum, so I think we have to move on. We have a point in time update. Ms. Corpo's here. Let's turn our attention to that. And there's a PowerPoint that we've all been given, so we are ready. All right, thank you.
Thank you, everyone, for letting me come and talk with you all today. I know a few of you in the room, but for those of you who not familiar with, my name is Lacey Hoyle, and I am the Homelessness Program Manager for Buncombe County. My position is situated in the Community Development Department of the Planning, Community Development Division of the Planning Department. So I am often working with the folks at the city who are leading the continuum of care. And I'm here today to share with you data from this year's point in time count. All right, so first I wanted to just start with a little bit about what the point in time count is. So this is a census of folks who meet the federal definition of literal homelessness. So that's people who are in emergency shelters, in transitional housing, or who are unsheltered on a single night. HUD requires that this count occur every 2 years in the last 10 days in January. In our continuum of care, we typically conduct this count annually. The jurisdictions that are included is Buncombe County and all of its municipalities. The count is managed by the COC lead agency, which in our case is the City of Asheville's Homeless Strategy Division. And so this year we had an evening count on January 28th from 4 to 7. And so during that count, teams of volunteers spread out in predetermined routes across the county to conduct surveys with folks experiencing homelessness. We also have been doing an additional count the following day for the last couple of years, which has been very successful for us in the daytime. So that count typically occurs mid-morning to early afternoon. It includes another street count, but also includes some targeted outreach to encampments by outreach professionals, as well as surveys being conducted at various service provider locations across the county. This year we had 135 volunteers for the point in time count. And so, next slide, please. Before we start to look in depth at the data, I wanted to just take a quick look at some trends. So on this graph, the blue line on the bottom represents the portion of the point in time count that accounts for folks who are in emergency shelter, transitional housing, and it also accounts for shelter overflow beds and code purple beds that might have been utilized on the night of January 28th. The peach portion of each column at the top represents the count of unsheltered, unhoused individuals. And you can see here that we did see an increase this year in that number, the number of unsheltered, unhoused individuals in our community. And then finally on this graph, the blue line represents the number of shelter beds that are available in our community on the night of the point in time count. So if the blue line falls in the peach portion of the column, which you can see it does here the last 2 years of the count, and various years before that, that means that we had more unhoused individuals total in our community than we had shelter beds available. Next slide. And then starting to look at the results themselves. So the point in time count is it divides everything up into the 3 categories. So emergency shelter, transitional housing, unsheltered. And so I've included here the 2024 count and 2025, just so we can take a look at the net change. Somehow by strange coincidence, we had the exact same number of people in emergency shelter on the night in 2024 that we did the PIC count, as well as in 2025, 270 people, so no change there. Transitional housing, we did experience a loss of transitional housing beds due to the destruction of the Veterans Restoration Quarters facility. So we see a net change. We had 93 less people in transitional housing beds that night. I think that's in large part due to that loss of transitional housing beds. The Veterans Restoration Quarters is operating at an alternative facility right now, but it's a smaller facility with less beds than what their usual location has. And then our unsheltered count increased by 109 individuals to a total of 328. for this year. I want to just note also that 116 of those 328 people reported that they are experiencing unsheltered homelessness this year because of Tropical Storm Helene. And so that brings our subtotal for this year to 755 total. And that is an increase of 16 people. However, this year was a little bit atypical because we had folks who were staying in FEMA's Transitional Sheltering Assistance Program in hotels the night of the point in time count, and HUD mandates that we do count folks for the point in time count who are staying in hotels that are paid for by an agency or organization. So the lead agency worked with FEMA to get some aggregate data for the folks who were staying in that program on that night. There were 1,548 individuals staying in hotels that night. And HUD requirements dictate that the lead agency should extrapolate some demographic data for those individuals based on census data. So we're going to look at some demographic data, and you'll see that it does not include that 1,500 folks who were in FEMA TSA, but the number that is reported to HUD for our continuum of care this year does include that number for a total of 2,303 individuals experiencing homelessness on the night of the pit count. And I want to just say one more thing about those folks in FEMA TSA, and that is that we do know that most of those individuals were not experiencing homelessness prior to the storm. And we also know that most of those individuals exited TSA to a transitional shelter or other permanent housing options. So this doesn't mean there's 2,300 people on the streets. It's just the way that we count for this particular count. Next slide. And so starting to look at some of the demographics for the folks who are experiencing homelessness in our community according to the pit count this year. The raw counts from last year and this year were not dramatically different in any of the categories that you see here. So I'm just listing the percentages for 2024 and 2025 and comparing it against data from the American Community Survey in 2024. You can see that the largest change was a small drop in the number of individuals who reported their race as white only, although this group is still the largest in our point in time count, which corresponds with countywide data from that ACS survey. When we look at the data compared to the survey, there are a couple of concerning disparities that I just want to point out. Although Black and African American individuals only represent 6% of our countywide population, this year they represented 17.6% of pit count respondents, which is a decrease of less than 1% from last year. So that's a disparity that we've seen for a couple of years now. And I also wanted to just point out that individuals who identify as American Indian, Alaska Native, or Indigenous represent only 0.6% of the county population, but they are representing 2.1% of the point in time count this year. And so these disparities are shared when this data is shared with the COC membership and the governing board, and it will inform our work moving forward as we're planning and developing housing and strategies to address homelessness in our community. Next slide. Looking at the demographics in terms of self-reported gender, we can also see that there are a disproportionate amount of males who are experiencing homelessness in our community when we compare that to the 2024 census data, with 65.8% of pit count respondents identifying as male, as compared to 48.2% of the county population identifying as male. And this is consistent with historical pit count data in our COC. It's also consistent with data that is being shared nationwide. More men are experiencing homelessness throughout the nation. And those nationwide percentages are actually very close to the percentages that you see here for our community. And again, this is helpful information for us to have and think about as we are looking at strategies for addressing homelessness here. Next slide. And then when we look at the folks, the age of folks who are responding to the pit count, we can see that the number of individuals under 18 who are experiencing homelessness, according to HUD definitions, have halved from last year's number. And most of the other age groups have stayed very similar. And I make that point about HUD definitions because I'm trying to point out that this doesn't include children who would qualify under McKinney-Vento. So we have lots more McKinney-Vento families since the storm than we had prior to the storm, but that is not represented in this data because McKinney-Vento's definition of homelessness is different from HUD's definition. It's a little broader. But this is also consistent with the past few years for us. We know that the vast majority of folks experiencing homelessness in our community are between 18 and 65, which is a wide age bracket. Next slide. And then this year, I wanted to look at how the PIT count breaks down geographically, as well as looking at families and household composition. So to do this, I looked at the volunteer routes that were created. Those routes don't strictly follow city limit lines. So I had to make kind of my best guess as far as how many surveys were collected in different areas. It's not surprising to see that around 94% of PIT count respondents are within Asheville city limits. What was a little surprising was that this year the number of respondents in particularly Swannanoa and Barnardsville did increase quite a lot. And so just as an example, I think last year in Barnardsville, we had 2 surveys collected versus 16 this year. I think that some of that increase may be attributable to the storm, but it is also possible because the methodology for the PIT count continues to improve year after year, that we're having more respondents and able to talk with more people than we were able to talk with in years past. I know, again, in Barnardsville, that one of the PIT count volunteers out there this year was a member of the community in Barnardsville. So she knew a lot of the folks experiencing homelessness. She knew where to find those folks, and she also had rapport already built with them, so they were more willing to answer those surveys for her. In terms of household composition, it's not really dramatically different. There is a pretty dramatic decrease in the number of families responding to the PIT count. I think that could have happened for a number of reasons, not least of which being that some of those families could be part of that FEMA TSA group. Or they may have found other solutions that would allow them to be counted in McKinney-Vento again, but not in the HUD definition of homelessness.
Real quickly, where does West Buncombe fit into that category? Inca, Candler, Leicester area?
Yeah.
Region, where does that fall in?
You know, that's a good question. It's not listed on here because there were efforts to collect surveys in Candler, but there were not any actually collected. We know that there are folks experiencing homelessness there.
Large camps out there.
Yeah, I used to live in Candler until very recently, so I'm somewhat familiar, but there were not surveys collected in that area, which could just mean that the folks that were approached didn't want to fill out the survey. It's completely voluntary, and we do have lots of folks each year who are approached and say, I don't want to participate.
So what is the engagement percentage then of like how many people you contact versus how many fill out the survey? Can you extrapolate that 30% are filling out the survey, that we have a hidden population of X?
That is a really good question, and I would be happy to get some more information about that from the lead agency. They collect all of the surveys and deduplicate the data, and there are some specific rules from HUD about how volunteers may be able to kind of generally count folks that they observe who don't want to complete the survey, but that's not data that's typically shared out with me or publicly, but I'd be happy to get that and send it out to
Is that
you all.
Homeward Bound? Are they a lead agency?
The city of Asheville.
City.
Yeah, the homeless strategy division over there. All right, next slide. And then I just wanted to show also these are self-reported additional characteristics. So this is a supplemental part of the survey that we ask folks to fill out. And there's no like additional verification for the point in time count for these characteristics. This is just what folks who are responding are reporting. So a couple of notable things here. We did have an increase in folks who reported that they are chronically homeless, which means they have been homeless for more than 2 years and have a qualifying disability. We also saw an increase in folks who are reporting serious mental illness and substance use disorder, responding to the survey and indicating these qualifications on the survey for themselves. So again, very helpful information for us as we're all working with these individuals and as we are working in the continuum of care to plan and strategize around how we're going to design housing interventions moving forward to try to target the folks that seem to need it the most. What questions do you all have for me?
Can ask lots of questions, but on the bed availability, do we have any data on bed utilization? Meaning that on any given night, 50% of beds are full versus the random count, just kind of.
Yes, yeah, so the Homeless Strategy Division of the City of Asheville works with service providers throughout the year to collect that utilization information. And it is reviewed with service providers as a whole. It's used in planning efforts. For example, we're starting to work again on planning for expanding emergency shelter capacity, and utilization is one of the things that the group of folks who are going to be working on that will be looking at and talking about, as well as talking with service providers about how to increase utilization. What are changes that we can look at making to hopefully help more people want to come into our shelters.
Lacey,
Mhm.
given this committee focuses on our system and systems improvement, is there and are there any limitations to the questions of these individuals, of how many of them are justice involved?
Yeah, so those questions are not part of the point in time count. But that is something that folks in the continuum of care have been working on. I know Josh and I were talking about it just before this meeting, and I know that data has been provided to the continuum of care, and this continuum of care is a newer continuum of care, and there's been just a lot going on. But it is on our radar to kind of start working in a more focused way with the justice system and folks who are justice involved to see how we can assist those folks in particular.
The questions asked, are they scripted or defined by HUD, or are
Many
they?
of them are. We do have the opportunity to add some additional questions, which we do each year. But we also do have a list of questions that are required that we ask by HUD.
Okay.
So it could be that in the future,
Yeah,
if we wanted to, we could ask some questions
Ask that
about
one, even if
justice
it's just that
involvement.
one question, that'll
Sure.
give us some indication as to,
Yeah.
you know, where our focus may give us some more reasoning, I guess.
Right, absolutely.
Does being in jail count as housed?
For the purposes of this count, it doesn't count as housed, but it doesn't count as what would qualify to be counted in this.
Is there a
Same.
measurement at the jail? I mean, if the 20 Davidson Drive addresses that are reported to the jail are usually people who are reporting no address or unhoused in some way.
That's actually a really good question. I don't know that I know the answer.
That when they put an address like for A-Hope,
Right, 19 North End, 20
Right,
Davidson
right.
Drive, you have a pretty good idea. I'm sure we all see those. As to, does that figure into the data at all? I mean, I'm not.
the data that we provided to the city regarding justice involved folks that are experiencing homelessness or unsheltered, yes.
Okay,
Yeah, but the data for this count, no. And this is it's a one night count. It's a snapshot.
Right.
So we know that it is not a complete picture of who's experiencing homelessness here. But it is one of our best methods at this point for kind of starting to get an idea of how many folks are experiencing homelessness here.
Question, on that issue of the families,
Mhm.
where you went from 10% to less than 2%.
Mhm.
Do you have a sense of that particular data point being super volatile? Does it jump around a lot? Or do you think that was a really unusual event?
No, it is volatile data. That particular piece of data does tend to jump around a lot. And it can have a lot to do with the availability. You know, we know that in our shelters in this community, there's very limited space for families. So it could be that in 1 year, there are beds available for families and there are folks in them, or on other years, they're not being utilized, things like that. But yes, it does jump around a lot.
Lacey, go ahead. So I understand this was in January, but do you have any insight into the seasonality of homelessness and whether that changes throughout the year?
Yeah, I mean, I don't know that I have that insight other than kind of colloquially based on my years and working on in-case management. But I know that our providers, particularly AHOPE, they are keeping a pretty close watch and could talk at length about that seasonality. We know that we tend to see a lot more people in the warmer months and in the fall, kind of like tourism here. And then in the winter time, folks are in other areas seeking out warmer places to stay.
With the FEMA temporary shelter folks, you said that the majority of them got some form of housing afterwards, but do we actually have those numbers?
We do have those numbers. I don't have them here with me today, but I will say that the city of Asheville and the planning department here at the county worked very hard with FEMA kind of throughout the duration of that program to keep an eye on those numbers, to make sure that we were providing support for folks who didn't have an easily identifiable option to exit that program, and trying to figure out, like, provide options, get creative, and really collaborate with each other. So that is data that we have. It's just not data that I have here in front of me, but I would be happy to send it to you if you'd like. Other questions for me?
Is the state validating any of that point in time against the state homeless database? I'd say, is it the HMIS or something like that?
The city of Asheville, in their capacity of the lead agency, works with HMIS and validates that data in terms of deduplication of data and things like that for submission to HUD. I don't know that the state is really working very specifically on that. Each HMIS system is managed by individual continuums of care and not by the state as a whole. All right, well, if there's no other questions, I will take my seat, and thank you so much for letting me talk with you guys for a few minutes today.
Thank you, Lacey. That was incredibly important information for probably everyone in this room. Thank you. So I think Ms. Herring is next. She may have some pretrial service updates.
Try not to hold you up too long. But as I think we talked about it at our last meeting briefly, and I just want to give you all an update on where we are with the pretrial services program. As you all know, we took a little bit of pause of new cases. We didn't pause the program. We continued to service existing programs, but we did a pause, and that, as you all know, and maybe you don't know, when I started in September, I started in September 20th, was it September 23rd? September 24th, Helene hit. So I didn't have a really any time to kind of get into the work of JSD, the department. We shifted right into emergency management, but sometime in December, I kind of was able to pull away and kind of focus on the department. And as all of you perhaps know, when you're coming into a new agency, you all do a little bit of a scan or a review of who does what and how things work. And so my coming in, I have 4 divisions. I include administration with that, is to kind of look at where our capacity is, what's working, what's not. And one of the things that I noticed is our pretrial services division and family justice center, they had the newest managers on board. And so the department head had left, they came on right in that space. And there was really no leadership, pretty much to guide them in their work. So those kind of were my focal points, pretrial being perhaps the most needed because there was some rising issues that needed to be addressed. So in that, that was my recommendation, is to kind of take a pause on new cases. So we kind of step back, look at the program. And one of the things that I noticed is because we do have staffing capacity issues, we can't, sometimes unfortunately in public service, we want to be all things to all people. And people expect us to be all things to all people, and to do all things that we cannot do. And sometimes we have to take that hard step to say, unfortunately, as much as we want to do everything and help everybody, we don't have the capacity or the money to do it. So we have to look back and do what is it that we can do for right now. Not saying that things don't change, but the dynamics of the storm, some other issues caused us to really have to rethink how we operate. That was a hard decision that the Board of County Commissioners, County Manager's Office had to take. And so my recommendation to them was that give me 330, it was crazy, but I said 90 days to try and look through all of this and get things in play. So 90 days is up, we're up and running, we're back to taking new cases. And what that involved is, we were doing electronic monitoring for everybody but we didn't have the capacity to do that. We didn't have the staffing, and it gave a perception that we were doing things that we didn't have the capacity to really do it and do it to the best of, I think, what we want to be able to do. And if we're going to talk about public safety, we want to make sure that we're doing public safety, the best benefit of the public. So we pulled away from that. It's not that electronic monitoring isn't occurring. It's occurring through Caitlin's Courage. They call it CGN9, the Criminal Justice Information something network or something. So it's doing that for your domestic violence, your sexual assault, and stalking cases. Those are still in play. And we're still working through our FJC with our domestic violence and survivors and doing those service provisions. And we're also, as far as pretrial, working with them, because what we didn't do, well, it was in place, but now we're implementing it back, is a domestic violence, intimate partner violence protocol, so that we are actually providing a level of care for those individuals that come through the system. And so what we're doing is, pretrial is not, and I think people call it a diversion, it's not a diversion. It's really, the way we're operating is as a service to the court. We're providing judges with information. What we're doing now that we weren't doing in the past is providing them with a PSA, a pretrial risk assessment on every individual. Now, we won't service everyone under the program, but we will provide them with information about everyone that comes to first appearance. We're also, and that's going to be a background check, and we're also having staff trained at the national level for, is it DCI? DCI, so they can provide them with not just arrest history for a local, they'll actually get to see nationally what a history is for someone, which is very important. We're also not serving people all over the country. People in New York, I don't know how we can't do that. Again, capacity. So we're going to stick to people in our Buncombe County and our adjoining neighboring counties, and I think it's like 6 or 7 of those. But we will do courtesy supervisions with agencies that do have pretrial operations in place, such as Charlotte, Raleigh, those other places within in the state. So we're trying to create those types of systems and put those in place, tighten them up. It's not like it wasn't happening. It's just we needed to tighten them up. We've implemented many policies and procedures. We've trained staff on those. And that's pretty much where we are with that program. It's been a lot of work. Staff has been, amazing. I have to give credit to our judges, because they have been This is not an easy thing to do, you know, in the midst of doing your work at the same time. But they've been very patient, and I thank you all for understanding and being a partner in this initiative. Because the whole point of it is it is a collaborative. Pretrial is not one of those things that I think works best in a vacuum. We all come together and there's a piece for us to work to make it happen. So that's kind of my update. We'll have policies and procedures. We'll have a lot of this up on our website. It'll be open. I have a whole binder of information I'll share with our commissioners and the judges. So they'll have a lot of background on what we've done over these past 4 months now. And that's all I have. Any questions? Comments?
Are we working on a bond policy, a new one? Judge Scott?
So, what does the statute say?
I-
Senior resident creates a bond policy reviewed by the chief district court judge is what the statute says.
I'll check in with them.
I know there was a stalemate in the previous one. I mean, let's not, and so there's a bond policy out there that was worked on, but I don't think it was fully signed, but, okay. And so pretrial will be incorporated,
A bond,
the reformed pretrial, for lack of a better phrase, will be incorporated in, or at least made reference to in the new bond policy, which we're all looking forward to.
Well, an addendum has been done back in January, where they did recognize it in the addendum. They haven't done a new or true revised policy. But I think that was something we spoke of here. I think it was at one of our meetings, we did well, it wasn't a JRAC meeting, we did, I pulled that together, and that was when we talked about the bond policy. And that's when the decision was made that they do the addendum. But I think that is something that the chief, the
senior residence.
Superior
Judge
Court
Thornburg.
Thornburg, thank you, is looking into. So
Okay,
that's my part of what I
That's
know.
what I was getting ready to also say. I believe he has been looking at it.
yeah, I know he was very interested.
I stand ready to
Certainly.
review it as mandated by the statute.
I'm sure he'll have it to you.
Thank you.
Any other questions? That was well said. Thank you, Ms. Daring. Thank you very much. So I think we have some new business. Ms. Tate, our Assistant County Manager, are you ready with some updates?
Yes, so I wanted to make this group aware of, if you haven't already heard, but we received the Just Home grant, which is funding to help with housing for justice-involved individuals, which is very exciting. I will say, when I first started in July with the Justice Services Department, I came and met with a few of you, and I kept hearing housing as a theme, something that's needed for this population. So thank you for sharing that, because that influenced our decision to apply for these funds. And so, again, give credit where credit's due. You all know this population very well, and you know what their needs are. And so the grant provides for a planning period, which we have a couple $100,000 to move through that planning period. It's going to start in July and hopefully, fingers crossed, end in December. And so be on the lookout, because we'll be wanting to engage you guys again, as you have a lot of knowledge around this population. And then the second part of the grant is a capital funding. So they call it PRI, and it's basically a loan for up to $5 million over 10 years at a 2% interest rate. And so the idea is, from the planning period, there will be some sort of capital need from that, and then, you know, some sort of housing need. And so that loan program will be to help support that. That's kind of the overview. During the planning period, we're really going to be asking our stakeholders, you all, as well as individuals with lived experience, who should we be serving? So I'll give an example. In San Francisco, they received the same grant. They determined the population that they wanted to serve were juveniles. So we need to think about, where are the needs and who might be a population that we need to serve. Maybe it's women, maybe it's, I don't know who the demographic is, but be thinking about that. So it's also the need in terms of the number of units. So that's something that we'll need to collect data about. And then what type of services do these individual needs? Once they're in housing, are there gonna be additional services that are needed for them? So those are kind of the questions we're hoping to answer during that planning period. And that's it. Any questions about just home?
Would these be new development of new housing stock, or is it renovation of existing housing stock? What's up there? I know we're looking, and Buncombe County has very low housing stock available anywhere in the system, and so will it be new developments?
It could be either or. So the other localities that have done this, most of them have been new construction of multifamily or rehab of existing multifamily. But we could also determine after the planning process that we want to do scattered site housing. We want to rehab some old homes and turn them into, housing for justice involved. So it really is gonna come, the answer is gonna come from that planning process.
And hopefully you all will participate.
Well, we'd love to
Yes.
participate. I was gonna mention that, we're working some angles, especially post Helene. We've lost several hundred units after Helene, and so states approved us investing 23 million in new housing in the area for people with disabilities. So we're looking at that. Of course, we're focusing on scattered site because, we want our people integrated across the community. And I think we got roughly about a $2 million investment we're gonna put into housing subsidies, because we know post Helene, what we're seeing is rent costs are going up all over because the housing stock's going down. And so people that are in their current housing now aren't able to afford it anymore with the current subsidies that they have. So we're seeing that across the system too.
That's
I'm seeing that housing prices have gone down between 6 and 10% in Buncombe County, and correspondingly, there's some issues that, we'll see how that affects.
We're seeing rent continue to climb.
Right, yeah.
Well, and the other challenge I think we have to look at is the long-term impact, because that was something we had talked about, is the long-term impact of new construction versus the rehab, because it's gonna be materials and those things, we don't know what that is. But it may be more to our advantage to look at rehab type of projects, so I'd like to learn more about what you're doing, because that might help us too.
Yeah, because they did give us a deadline of end of 2026 when we would need to make sure that $5 million was, appropriated. So we received this grant pre-Helene, and then we obviously had to delay everything, and so that means we're behind all the other jurisdictions. So they're trying to get us caught up to that.
So it made some interesting concessions for us.
Yes.
Is the grant limited to just one target population, like just juveniles, or can you have a mix
No.
of population?
That's the need of the reason for the planning is it's what we deem to be most appropriate. My
It can be
sentiment,
several different populations that are
Yes.
deemed
Yeah.
most appropriate.
They have,
You should consider the juveniles.
Yes.
so
Because in the justice involved juveniles in particular are being housed on Old Landfill Road in Alexander, North Carolina. So they're way far away, in Taylorsville, right next to the men's prison there.
that's the whole point of that. And for me, it's defining what we mean when we say justice involved, and the like. That's the planning part is gonna help us to clarify that, define that a little bit more, that population.
Yeah, I'm not saying you could be a one-for-one replacement of juvenile detention, but at the same time, we could have some alternative for those kids.
There's a lot of licensure conversations
Right,
involved with
yeah.
that. When you talk about juveniles, you're gonna need to have the state at the table with that.
So you also have a lot of families that have comorbidity factors related to being involved in GJJ, homelessness, mental health, domestic violence, and that group of people often is involved in in DSS matters. So if you're talking about housing, to me, one of the first populations I think of is addressing a family that's in need, that is intersecting with the county through DSS. That would help assist that across several different realms, whether it be adult, juvenile, DSS, and other such things. So maybe your target population could be juvenile through DSS involved youth.
It's a great example. We see a really huge deficit with multifamily. They have multiple siblings that are coming involved with DSS and DJJ. And they all get split, you know?
Correct.
All over the place because
Well, I'm
there's
sure
no family
gonna
unit.
be a part of this planning group. Not wanna hear, you know, y'all better be at the table, because all of this needs to be heard, because then you get the planning group and y'all don't show up, and now we don't know what we're supposed to be doing. But it's the wisdom that, you know, if we're gonna do it, we need to have the wisdom, people at the table, and let's figure it out. And I would like for it to be sooner than later. And I know it's a lot of people scheduling, but you know, if we can kind of make it a priority, that we can have you all at the table and you know other folks that would be, because to me, your staff is great. But for me, I need the people who are gonna make decisions at the table, if we're gonna get anywhere. I'm just blunt, sorry.
And the last little thing I'll say about this is Lee Creighton is doing an existing data review right now. And so if there is data that you all have that is associated with housing and justice involved individuals, or data sets that you are aware of, please let us know and we'll get those to him.
We're working now, you know, the state's got a big push around prison reentry. And so we are working really closely with them on several models of in our prison reentry system on how many people are being discharged from the prison system and where they're coming back to. We've developed several transitional housing places where we can put people until we can find permanent housing. That's why it's a problem. And so I know we've got several transitional homes that were in the queue, but that would be great data, I think, to look at on where people are getting stuck in that transitional housing because there's no availability for long-term housing.
We reach out.
Is it your group that's doing the SIM?
Yeah.
That's coming up in August?
I don't know if we're doing yours, but we do most
No,
of the
no,
counties
it's
around
just,
here.
no, I was trying to piggyback off you, I think it was yours.
I think one of his people's on the 15th floor, as I recall. How many people do you have? Do you know in the county?
In our
We don't have
agency?
nobody on that, he don't have anybody on that.
Are you referring to Brent
Yeah,
with RHA?
Yeah.
That's not his group.
That's somebody we contract.
Gotcha.
To do it.
Gotcha.
But we have a whole,
I'm sorry,
whole team.
contract, not with him.
That's right.
Terribly sorry.
And Josh, you might have some information in our Justice Resource Center for the recovery residences and the treatment courts that might need housing and payment for that housing. So maybe that could be a part of that, I'm not sure.
Absolutely. That's a huge need. It's not, that's anecdotal, but,
I mean, it's not a large percentage of the population, but it sure is important and it impacts our jail numbers. So recovery residents would be really important. Is there anything else? We can move along. So it looks like Brent Bailey will be giving all of the updates for our subcommittees. I'm
Now, just that one.
excited to do that.
Speaking of prison
So since you're
reentry.
the only name up there, Mr. Bailey, we figured we
I
could
know,
just give you
but the little
updates
judge
for
got
everybody.
they,
Oh,
that's just me here.
I thought maybe they sent them all to you.
No,
Well, you take your time then.
well, thank y'all. So I'm Brent Bailey and I'm the staff support for the community engagement work group. I always emphasize that because about 4 years ago, I stepped into that 3-month position. Do the math. About 4 years ago, I made a 3-month commitment and I'm still here. So I've come to give updates on community engagement. Currently scheduling some information gathering sessions from people who've been previously detained in the detention center. So once they are released, sometimes people come to the JRC to engage with services. And so we want to have a conversation with them and get their perspective on like access to resource information while you're in the jail. Another thing we think is key is like when to introduce that to someone in the jail. When you first go to jail, the priority is getting out. So when somebody first goes to jail, the only resource they probably want to know about is a bondsman and calling people, see if somebody come get me. So we want to kind of talk to people, engage. When does it kind of settle in that for those this happens to, like, I might not be getting out like I thought I was. So when do I pivot? And then that would be the time to maybe start introducing the resource information. Because if you catch them when they first come in, you know, they're not really listening. And we want people to be accessing the resources, the information while they're in, and then coming up to the JRC once they get out. And so just trying to make sure that they have access to those things. The work group is also currently reviewing data from the jail and the JRC to determine what kind of trends we see related to things like recidivism, being unhoused, and other various barriers to success. And so just for example, one of the first things we noticed, and when Lacey was up here, she was kind of giving them disproportionate things, but we noticed like there definitely are people of Hispanic descent or Latinos in the jail. We don't really hardly see any at the JRC. So once they're released from jail, they're definitely not coming out to access resources. And so, you know, something we said was, well, maybe if we could get some of our materials printed in Spanish, you know, that could help. That's just a start. So that's one thing we've done. We recently had Diana Powell from Raleigh present to the work group about their court advocacy program in Wake County. And so the community members had reached out to me because they had heard about this and they were interested in, hey, maybe we could have something similar to that in Buncombe County, where like community members kind of come to court and help to advocate for some people. And judges, I know y'all don't understand this, but you know, the courtroom can be a very intimidating place. You know, people walk in their courtroom and they just get nervous and flustered and all kind of different things, and sometimes not even properly maybe advocating for themselves. And we're talking about things like fees and fines and things to that effect. And so that's had her present on their program, and so we're hoping to maybe get something like that here. Simple, glad to hear about the Just Home project and the planning, July to December. Many community members, when that was first coming down the pipeline, they were very excited and very eager to get going. Then of course, the storm happened, and so that kind of delayed things. But I'm glad to be able to go back and tell them, like, we got to update the planning. It's probably starting July. I think it was mentioned about one of the focuses for them was, so we have people that will come out of prison back to Buncombe County, and then they're going to transitional housing. And like he mentioned, rent being so high, sometimes they end up in transitional housing for a long time. And part of Just Home was about sustainable, affordable housing, because understanding that has been a reason people will return to the jail. So we don't, you know, hopefully we can help people not to be returning to jail just because they couldn't have sustainable and affordable housing. We want people to come out and start working and all these different things. And for those working in service industry and jobs like that, we want them to be able to have somewhere to live as well. So excited about that. Also, the AOC has recently released their statewide court appearance project report. And so our work group is, it's an extensive report. So we're reviewing the report to see what kind of things we can do and implement that's in accordance to the recommendations made there. And so that's kind of the update from community engagement and the things we have been working on in the recent months. Any questions? Anybody? Okay, yes.
I just pulled up that North Carolina statewide court appearance project because it's really long, and I was gonna encourage everyone to read it. I keep telling myself to read the whole thing, but it's manageable portions. But they make a lot of recommendations that in some of these subcommittees we talked about, because it can certainly reduce populations in our jail by implementing some of their suggestions. So it was something that we were gonna do ourselves. Well, it's already been done. So we don't have to reinvent the wheel. We can implement what they're recommending if that's something that fits our community. So I think it's a great resource. And I think my understanding is that AOC is willing to work with us if we have questions or we want to know how to implement. So that's a great resource.
And that's very encouraging, because like our work group definitely wants to be collaboration with the courts and working to do those different things. And like I said, at the end of the day, I mean, it just boils down to reducing the jail population. And you know, I know my community members don't like when I say stuff like this, so they not here so I can say it. Like, we want to make sure who should be in jail is in jail. And like, who shouldn't be in jail is not in jail. So, some of them don't think nobody should be in jail. They just need to go there.
To build on what Judge Keppel mentioned, is there someone who can do a presentation about that report for this group? Or-
Yeah, Eric Jackson can, absolutely.
Okay.
Nice.
You can let them know I volunteered them. But I will, you want him to come to maybe potentially the next JRAC and report?
Well, we can talk about it. I was
Okay.
just curious if that was something.
Oh, yeah, we definitely have, yeah.
Okay.
And Eric chairs our input and analysis subcommittee. So, and he's wonderful. We're glad to have him. Thank you for letting us have him, Deborah. Appreciate it.
Retired, so.
Yeah. Any other questions?
That's it.
All right, thank you.
Thank you, Mr. Bailey. Are there any announcements? Does anybody want to go around the room? Any announcements from your agencies? Anything from APD, the clerk's office? Not to put you on the spot.
I don't think so. I think we're, yeah.
Okay, you guys good?
We're just plugging along.
Judge Scott, anything from us?
I've been told to keep my mouth shut, so I'm abiding by what I was told. I am exercising some grace. I have plenty of observations that I could make, but I will keep my thoughts to myself. I will mention this, unfortunately. Most judges receive trauma-informed training. And I think before people talk about how bad court is or how difficult it is, they should come watch a judge in court. Because sometimes judges, in particular one that I happen to be sitting right next to, have remarkable grace, decorum. They care about each person that appears in front of them. And I think before statements are made relating to how people are treated in court, one should see what it's like to be in court in front of a particular judge. And room for improvement can always be had, right? But at the same time, I think there is a lot of really good judges that really take the time to do the absolute best that they can in a very difficult situation. Judges are humans too. It ain't easy for a judge to put someone in jail for a long time as well. So why don't we all exercise a little grace in that environment?
I agree. I think we have wonderful judges. And my statement was not that judges are mistreating anybody. It was how people feel coming in. They don't know you and they ain't even been in there yet. They ain't even had the experience, but just walking through the door, I see people almost going to a full-blown panic attack. And I was simply stating the fact that like, you can be, and y'all wonderful, but it's just intimidating for them. And we just want to say, hey, we want to show you have support. That was
I understand completely and totally. If the popo showed up at my house, I might feel a certain way about it myself.
Yeah.
Understand it from that basic human condition. My only concern is having people appear in court to, quote, assist people could possibly be a violation of the law. So there's that unauthorized practice of law. So when we start going too far down the road for people, quote, advocating for people, I want to make sure that we don't violate the law. Now, it's not a bad idea in principle, but unfortunately the General Assembly has NCGS 84.4.
Well, and just to follow up on what Brent was saying, because he had brought it to me and I told him, let's pause and let's kind of put our bearings together before we launch anything. And that would be done in coordination with you all anyway.
I think it's a great idea, but you gotta be really careful. And so
So we would do it in collaboration with the courts.
Any other announcements?
There was someone who had a public announcement, public, are they here?
We do have someone registered online for public comment. They haven't connected through the phone bridge, which allows them to talk through the Zoom without being on the Zoom. So I would just give this reminder, if you are, I think it's Stephen S. Thomas from Goodwill, Western North Carolina. If you would connect to the phone bridge using the information on Engage, that would allow us to patch you into this call. And if not, you can provide a written comment. So maybe give it about 60 seconds. Kind of a complicated call-in procedure. Last call to connect that phone bridge. I think we can go ahead and call this.
So we were unable to connect for public comment.
They did not elect to connect. So they registered, but did not actually connect to the system.
All right, well, thank you. So I believe there's no one for public comment, so we will adjourn. Our next meeting will be August 1st in this same conference room from 12:30 to 2. Thank you all for being here.